muy buenos días, good morning, bon
All
día
right,
a todas
so
y todos. Un gusto
again,
estar
good
compartiendo
morning,
con
everybody.
ustedes
It's a pleasure
hoy
to be
este
sharing
webinario desde la Organización
this webinar
Panamericana de
with
la
all of you
Salud
from
sobre
the Pan
modelos de
American Health
financiamiento
Organization on financing models
para la salud mental con enfoque en la
for
atención
mental
primaria
health with a
de
focus
la
on
salud.
primary healthcare.
Mi nombre es Carmen
My
Martínez
name is
Viciana.
Carmen
Voy a
Martinez
estar
Viciana. I am going to be
compartiendo estas
opening,
primeras palabras
sharing these
con
words
ustedes.
with you folks.
Esperamos realmente que vaya a ser
We
un
hope
webinario muy
this will
provechoso
be a
para
very
todas y todos.
um,
Desde ya
useful
comentarles
webinar for
que
everyone.
tenemos la oportunidad de tener
Wanted to
interpretación
mention that we
simultánea
have
de español,
simultaneous interpretation
inglés y
in
portugués. Así
Spanish,
que, como
English, and
saben, pueden
Portuguese. So, as
utilizar
you all
la
know,
aplicación de Zoom.
you can use in this
A
Zoom
veces lo van a
application,
tener
sometimes
directamente
you'll
ahí
have
como
it
una de sus
directly there
opciones, a
as
veces van
one
a
of your
tener que estar
options.
en ese
Sometimes you'll need to
circulito con
be
los tres
in
puntos
that
donde van
little
a poder
circle with the three
elegir
dots where you'll be able
la
to choose
interpretación
the
en el
interpretation
idioma
in the
que
language
consideren.
that you choose.
Muchísimas gracias
Thank
por la
you very
asistencia.
much
Vamos viendo que se siguen
your
uniendo
for being here. We see that
muchos colegas de la
many
región, así que
colleagues in the
muy
region are still joining,
bienvenidos
so all of
y
you very welcome.
bienvenidas.
Welcome,
I
ladies and
will start
gentlemen.
with a few words in English in this moment. Welcome again to this first event in this year, in 2026, for the Mental Health Webinar Series. It is really a pleasure to welcome you to today's session, as I mentioned, titled Financing Models for Mental Health with a Focus on Primary Health Care. I am now talking on behalf of Renato Oliveira Souza, our head of the Mental Health and Substance Use Unit at the Pan American Health Organization. I would really like to emphasize the critical importance of today's topic. Mental health, as you know, is an essential component of individual, social, and economic well-being in Latin America and the Caribbean, and it is closely linked to the right to health and sustainable development. The COVID-19 pandemic highlighted and further exacerbated even the urgent need to strengthen mental health systems, generating significant setbacks in progress towards the Sustainable Development Goals and widening gaps in access to health services, including mental health care. These impacts occurred in a context of persistent structural weaknesses in the region's health systems, characterized by chronic underfunding, uneven allocation of resources, fragmentation and segmentation, as well as high levels of out-of-pocket expenditure of all which disproportionately affect population living in poverty and vulnerable population. Recent evidence also shows a growing gap between the burden of mental, neurological, and substance use disorders and the level of public investment allocated to mental health. Spending remains insufficient and continues to be concentrated largely in psychiatric hospitals, often at the expense of primary health care and community-based services. PAHO concurred that strengthening primary health care constitutes a central strategy for advancing towards universal, comprehensive, sustainable, and resilient health systems. Primary health care offers a key platform for integrating mental health, which requires sufficient and specific financial mechanisms. In this context, today's webinar aims to promote technical exchange and regional dialogue on financing experiences and strategies that support the integration of mental health into primary health care, while fostering sustainable, people-centered, and community-based models of care. We would really like to thank our panelists who will share valuable experiences, challenges, and lessons learned to help advance this important regional agenda. Y sin más preludio, vamos a empezar la sesión.
And without further
Muchísimas gracias
prelude,
por
we'll
la
start the session. Thank
participación de
you
nuevo.
very
Estamos
much for
teniendo
your participation.
un
Again, we
foro muy
see
amplio.
quite
Y
an ample
gracias, Luz, por
group of people,
continuar
and
con
so
el
thank you,
preludio.
those for continuing with the webinar.
Muy buenos días a
Well,
todos y
very good
todas.
day to
Mi
everybody.
nombre es Luz
My
Marina
name is
Ledestra.
Luz
Soy
Marina
consultora
Ledestra. I
internacional
am an
en salud
international
mental
consultant
en la
in mental
Organización
health
Panamericana de la
at
Salud
the Pan American Health
y voy a tener
Organization.
el gusto de
And
acompañarlos hoy
I will be
como moderadora de
with you
este
folks today
evento.
as a moderator of this event.
Antes de comenzar, voy
Before
a
we
hacer
begin,
referencia
I
a
will
algunos
refer
aspectos
to some
operativos.
operational
Tal
aspects.
como explicó la doctora
As
Martínez,
Dr.
Viciaga,
Martinez
este webinar,
Viciana
este evento,
explained, this
tiene la
event, this
función
webinar,
de
has the goal of
traducción a inglés, portugués y
getting
español. Para
Portuguese,
acceder,
Spanish, and
pueden
English
hacerlo a
translation.
través de los
You
3
can do this,
puntos
access
que
this
están
through
en la
the
parte
points
inferior de la pantalla.
found on the lower part of
Allí
the
van a ver
screen.
la
There you will
opción
see the
interpretación.
option for interpretation.
Tiene el logo de un
It
globo
has the logo
y
of a
allí
globe,
pueden acceder al idioma
and there you
de
can
su
access
preferencia.
the language you prefer.
Con respecto a los canales de comunicación,
Now,
los
with regard to
invitamos a
communication
usar la
channels, we
función
invite
del
you
chat
to use
para
the chat function
saludos
for
generales
greetings, general
y
greetings,
la función de
and the
Q&A para las
Q&A
preguntas y
function for
respuestas.
questions and answers.
Entonces,
So,
los saludos y comentarios los podemos
greetings and
hacer en el chat
comments we
general
can
y las
do in the
preguntas
general
en esa
chat, and
sección
the
que también
questions in
aparece
that
debajo de la
section that also
pantalla
appears
y que está
under the
señalada
screen
con la
and that is
Q y
signaled
la A.
with the
Allí
Q
vamos
and the
a
A. So that
recolectar,
is
recibir
where we will
todas las
be
preguntas que haremos al
gathering
final de
all
la
the questions we
sesión
will
a
ask at the end
nuestros
of the session
panelistas.
that we will be
Esta
asking our
sesión
panelists.
está siendo
This
grabada
session is being
y
recorded
posteriormente va a estar
and
disponible
subsequently will be
junto
available
con las presentaciones
together with
autorizadas por los panelistas
presentations
en la
authorized by
página web
panelists in
del
the
evento, que se los pondremos
event
en el chat.
website that we will place in the chat.
A continuación, les
Up
voy
next,
a presentar la agenda
I will
del día de
introduce
hoy.
today's agenda.
La primera presentación
The first
será
presentation will
un
be
panorama de los mecanismos financieros
outlook of
para
financial
avanzar la salud mental
mechanisms
en las
to
Américas.
advance mental health in the
La realizará
Americas.
la doctora
It will
Olga
be carried
Toro,
out
quien
by
es
Dr. Olga Toro, who
psicóloga y
is a
doctora en salud
psychologist
pública
and a doctor in
de la
public health
Universidad de Chile.
at the University of Chile.
Ella se desempeña
She
actualmente como directora del Centro
is
Colaborador
working as director for the
OPS-OMS
Collaboration
para
Center
el desarrollo,
for
capacitación
PAHO
e
and
investigación en
WHO for
salud mental.
development training and research in mental health.
Luego
Then
tendremos
we
la
will have
presentación de Uruguay
a presentation by
con
Uruguay
respecto a la estrategia
with
Acción
regard
País,
to
donde
country
expondrán
level
el
action
licenciado Rodrigo
strategy,
Márquez y el
which
licenciado
will be run
Gerardo
by
Brusone,
Rodrigo
quienes son
Marquez
director
and
y
Gerardo
subdirector
Bruzzoni,
general
who are
de la
director
Secretaría
and
de Salud
subdirector, respectively,
del
of the
Ministerio de
Secretariat
Salud
of
Pública
Health at the
en
Ministry of Public
Uruguay.
Health in Uruguay.
La tercera presentación,
The third
el
presentation,
financiamiento de la salud mental en Brasil,
financing of mental health
la
in Brazil,
realizará el doctor
will be
Marcelo
carried out by
Chimati,
Dr. Marcelo
director
Chimati,
del
director
Departamento
at
de
the
Salud Mental, Alcohol
Department
y
of
otras
Mental
drogas
Health,
de la
Alcohol, and Other
Secretaría de
Drugs
Atención
of
Especializada
the
del
Secretariat for
Ministerio de
Specialized
Salud.
Care at the Ministry of Health.
Al final de las presentaciones,
At the end of the
tendremos
presentations,
un espacio
we will
para
have a
preguntas y
space
respuestas.
for questions and answers.
Y al final,
And at the
los
end,
comentarios finales y cierre
final
estarán a
comments and
cargo
closing
de
will
Carmen
be
Martínez Viciana,
by
quien
Carmen
es nuestra
Martinez Viciaga,
asesora
who
regional
will be
en
our
salud
regional
mental
advisor
para
in
América
mental health
Central,
for Central
Caribe
America,
Latino y México.
Latin, Caribbean, and
Muchas
Mexico.
gracias.
Thank you
Y
very much.
habiendo realizado
And
esta breve
having
introducción,
carried out
le
this
cedo la
introduction,
palabra a
I would
nuestra
yield the floor
panelista
to
Olga Toro.
our
Muchas
panelist,
gracias.
Olga Toro. Thank you very much.
No se te escucha, doctora Olga.
To let you know, Dr. Olga, we
Perdón, me
can't hear
había
you.
desmuteado mi micrófono.
Sorry, I hadn't unmuted my microphone,
Estaba
she says.
agradeciendo
I
la invitación
was
de
thanking you
participar
for the
en
invitation to
aperturar
present,
este webinario
to opening
y
this
agradecer la participación
webinar,
de
and
todos
also
y todas.
thanking the
Si me
participation of
confirman si se
everybody.
visualiza
If you could
bien la
confirm, if
presentación
you
que me
could
estará
see the
acompañando.
presentation well, that will be accompanying my
Perfecto.
presentation.
Sí.
Muchas gracias.
Okay, thank you very much.
Bien. En los últimos años,
All right, well, in the
ha
last 2
existido una
years, there
especial
has been a
preocupación
special concern
por el
for
financiamiento de los sistemas de
financing
salud en el campo de la salud
healthcare
mental.
systems in the
Y
field
cuando
of
hablamos de
mental health.
financiamiento
And
de
when we
la
talk
salud
about
mental,
financing
hablamos
for
de
mental
presupuesto,
health, we talk
y
about
veremos
budget,
que no solo
but
es
we
el
will also
presupuesto.
see that it's not just
Y
about budget.
creo que es
And that's why
importante poder
it's
abordar
important to
algunos
be
de
able
estos,
to address some of
otras
these,
dimensiones
some
que
other
compone el
dimensions
sistema
that
de
make
financiamiento
up
para la
the
salud mental.
financing system for mental health.
Sabemos que los
We
países
know
han ido
the
incorporando
countries have been
paulatinamente el
incorporating
financiamiento
gradually
explícito para la salud
explicit
mental.
financing for mental health.
Es así que el
And
último
it is so
reporte
much
del
so
Atlas de
that the
Salud
latest
Mental
report for
ya
the Mental
mencionó
Health
que el
Atlas
87%
points
de los
out already
países
that
que reportaron
87% of
lo han
countries
incluido,
that reported
aunque
have
se
included it,
mantiene un
though
presupuesto que
they keep
bordea el
a budget
2%
that
como
borders 2%
porcentaje medio del gasto público
as
que se
as a
asigna
median
a salud mental.
public
Ahí ya
expenditure
tenemos
for
un
mental health. So
desafío.
right there we have a
Por otro
challenge.
lado, luego de la pandemia y a
Also,
propósito del
after the
informe de la
pandemic
Comisión de
and
Alto
in light
Nivel
of the
sobre
report
Salud
by
Mental
the High Level
y
Commission on
COVID,
Mental Health and
se
COVID,
reitera que aún
they
el
reiterate that even
porcentaje de ese
that
presupuesto
percentage of
se
that budget
concentra en hospitales
is
psiquiátricos,
concentrated in
lo que
psychiatric
termina
hospitals, which
subfinanciando los
ends up
servicios comunitarios de atención
subfinancing
primaria, la
community services,
prevención y la
primary care,
prevención,
promoting
de
and
manera que
prevention
aquí se
in a
presenta
way
un segundo
that
desafío, es
it
cómo
poses a second challenge
desconcentramos este
with
financiamiento
regard to how
que ya
we
reconocemos como
deconcentrate
limitado
this financing that
en
we already
el
know as
conjunto de la
limited
red de atención en
in
salud mental.
the
El
set of
Banco
mental
Mundial
health care.
ha sido en su
The
informe
World Bank has been
respecto del financiamiento de
in
la
its
salud mental
report
en
of
Latinoamérica y el
mental health
Caribe,
financing in Latin America,
también
Caribbean,
nos ha alertado
has alerted us
respecto
to
de algunos de estos
with
componentes
regard
que
to
ya
some
se
of these
venían
components,
observando
which
en los
had already
informes
been
anteriores.
observed in previous reports.
La estrechez del
So
financiamiento,
the
los
narrowness of
problemas de
financing, the
distribución, pero
distribution
también nos
problems, but
agregan
also
nuevas dimensiones.
they add new
El déficit
dimensions.
de información
The
financiera que sea
financial
válida,
information
el que
deficit
los marcos
uh,
presupuestarios
being
de los
valid,
países
the
tengan un
having
espacio fiscal
countries
dedicado a
to
la salud
have a
mental,
fiscal space
y
assigned to mental
que
health
los paquetes de
and
beneficios
having
y la
benefit
planificación
packages and
sanitaria
health
presentan
planning
inconsistencias con el financiamiento.
have inconsistencies
También
in planning.
la Organización para la
The
Cooperación y el Desarrollo
Organization for
Económico
Cooperation
ha
and
reiterado en estos
Economic
mismos
Development has also
diagnósticos,
reiterated in these
insistiendo
very
en la importancia de
diagnostics,
incorporar
insisting on the
incentivos
importance of
financieros
incorporating
a esas
financial
prácticas
incentives
costo efectivas
for
comunitarias.
cost-effective community
Es
practices,
decir, los
meaning
diferentes organismos
the various
multilaterales en sus
multilateral
informes
organizations
especializados
in their
nos
specialized
señalan que
reports are
existen
pointing out
importantes
that there
desafíos
are
en el
important
financiamiento de la
challenges
salud
in
mental. El
mental health financing.
financiamiento es clave para el
Financing is
logro de los
key
planes,
for
programas y
achieving
servicios
plans, programs,
en
and
el caso de la
services.
salud
In the
mental.
case of
La
mental health,
capacidad de pago de las
the,
personas no
the
puede ser una
capacity for
barrera para el
payment,
acceso a los
uh,
servicios de salud
people's
mental,
capacity to pay can't be
y
a
cuando se
barrier
observa un
for mental
esfuerzo
health services.
público por
And though
financiar
we can
atención en
see a
salud
public
mental,
effort for
aún es
financing mental
insuficiente.
health care,
La
it's still
pregunta es si se trata
insufficient.
solo de
The question
presupuesto
is it
o
just a
en
matter of
realidad
budget,
debemos
or
avanzar
do
hacia un
we really
modelo de
need to progress
financiamiento
toward
transformador de
find
la salud mental?
transformative
Pues bien, veremos que se trata
financing
de ambos.
models? So we'll see that it's both.
El fortalecimiento de los sistemas de salud
Strengthening healthcare
implica también
systems implies
fortalecer una de
also
las funciones
strengthening one of the
esenciales que es
essential
la
roles,
financiación.
which is financing.
Existen modelos que nos
There are models that
describen de manera
describe in a
sistemática
systematic
de qué
way
forma los
how
sistemas de financiamiento
financing systems
permiten
allow
otorgar
the granting
a los
and
beneficios que los
contribution
sistemas de salud quieren ofrecer a su
to the
población.
benefits of the healthcare
este
services
modelo
that
de
they want to offer, the countries want to offer their
profesionalización,
populations. So in
observamos
this
en el
graph by
cuadrante
Professor
marcado en rojo
Kutsin,
que
we
el
see
sistema de
marked in red
financiamiento
that the
específicamente
financing system
debe hacerse
specifically
cargo de la
has
generación
to
de recursos.
be in charge of
Nosotros
resource
podemos tener
generation.
entonces
And
el
here we can
desafío
then have,
de
for example, the
incrementar
challenge
la
of
participación de los
increasing
impuestos
participation
públicos en
in
salud
of the
mental
public
por sobre
budget
el
in mental health
2%,
above
pero
2%,
también existe
but
funciones
also
sobre la
that there are
administración de
rules
estos
for
fondos
managing
y
these funds
sobre
and
cómo los
on
asignamos
how
en la
we
compra
assign
de servicios,
assign
cómo
that
los asignamos a los
as
proveedores de atención.
service purchases
Estos
to the
modelos
various
ya
healthcare
señalan
providers.
entonces
These
que la
models then
función
point
de
out that the
financiamiento
role of
implica que
financing
los
implies
países deben
that
tomar
countries
decisiones
have to
en
make
varios
decisions in
Por
several
ejemplo,
areas. For
en
example,
cómo se va a asegurar
in
que las
how
fuentes
they
de
will ensure
recaudación
that the sources of
incorporen
revenue gathering
específicamente fuentes que van a
explicitly
apuntar al gasto en
include
salud mental.
benefits that will point to
Decisiones
mental
que
health
que
services.
tienen que ver
These
con
are decisions
cómo
that have
los
to do with
sistemas
how
de los
the
países van a
various
asegurar la administración
frameworks
de esos
countries will
fondos
use will
en
ensure
sistemas de
administration of these
prepago, de
funds
manera
in
que la
prepaid
población
schemes so
esté
that the
cubierta,
population is
sean
covered,
mediante
be
seguros,
it through
sean mediante
insurance,
esquemas
be it through
gubernamentales,
government
tanto
schemas,
como
be they
voluntarios,
voluntary
en
or
fin.
obligatory,
Que eso,
etc.
la salud
And
mental
that
esté considerado en
to
esos
have mental
esquemas.
health be considered in
También
those schemas.
los sistemas de mecanismos de pago a los
Also,
proveedores
mechanisms, payment mechanisms for
también esté considerado en los
the various
paquetes de
levels need to be
beneficios
considered in
y se
benefit
defina
packages.
explícitamente
And
qué
we need to have
incluye y
explicit
qué
definition of
se
what is
excluye
included and what is
como
excluded
mecanismo
from
de restricción.
as
La
far as
administración y
restriction
gobernanza
mechanisms
está aquí al
go.
centro, es clave
Governance
para
here in the
articular
center, administration
todos
and
estos
governance is
sistemas
key to
y
articulate all of these
funciones que requieren
systems and
decisiones
roles that
donde
require
la salud
decisions
mental debe estar
where mental
presente.
health must be present.
Si yo tuviera que
If
priorizar
I had to
ahora,
prioritize
en
right
una
now,
etapa inicial en que los
in an
países
initial
se
stage
están
where
haciendo
countries
cargo de estas
have to
temáticas,
take
quizás
care of these issues,
priorizaría
I
en
would
3
probably prioritize
dimensiones.
3
La primera,
dimensions. The
tener,
first,
prestar atención sobre la
paying
eficiencia.
attention to
Cuando
efficiency.
hablamos de
And when we
eficiencia,
talk of
estamos hablando
efficiency,
la
we are
responsabilidad
speaking
del
of the
uso de los
responsibility
recursos.
in the
Y
use of
aquí
resources. And
tenemos
here
la
we
forma en que
have
asignamos
the way
los
in which
recursos
we
en la red
assign
de
resources in the
atención,
network,
que
in the
es la
care
eficiencia
network, which
asignativa,
is
en
ass
donde
assigning
necesitamos
efficiency,
asignar los
where
recursos donde se
we need
genere
to
el
assign
mayor valor
resources
social
where
y
the
sanitario
most
posible.
social and health
Por
value
otro
is
lado,
possible.
la eficiencia
And then
técnica, en
technical
que
efficiency,
asignemos los
where
recursos
we assign
dentro de los
resources
proveedores de atención
within
en aquel
healthcare
lugar donde
providers
se utilicen
in
las
the
intervenciones más
places where
cost-efectivas,
the most
de manera a
cost-effective
evitar desperdiciar recursos
interventions are
y
being carried out
mantener
so
la
as to
calidad de la
not
atención.
waste resources
Cuando
and be able
hablamos
to
de
keep the
eficiencia
quality of
asignativa y
resources. So when we
eficiencia
talk about
técnica,
assigning
el
and
camino
technical
nos lleva
efficiency,
a
the path
priorizar sobre
takes us
intervenciones de salud
to
mental
prioritizing
en la
mental
atención
health
primaria de
interventions
salud
in
y en
primary
los
healthcare
servicios
and
comunitarios.
in community services.
Un segundo concepto que
A
yo
second concept
priorizaría
that I
es el
would
plan de
prioritize
beneficios.
would be the
El plan de
benefits plan.
beneficios es un
The benefits
instrumento de
plan
la
is an
política
instrument
pública que nos
of
permite
public policy
establecer de
that
manera
allows us to
clara qué
clearly
servicios,
establish what
intervenciones,
services,
medicamentos, programas
interventions,
y niveles de
medications,
atención
uh,
serán
programs,
financiados
and
con
care
recursos
levels will be
públicos,
financed with
así
public
como las
resources, as
condiciones de
well as the
acceso,
conditions for
cobertura y
access,
garantías
coverage,
asociadas.
and
El plan
associated
de
guarantees.
beneficios
The
es
benefits
una
plan
ruta que
is
permite
a
a la
roadmap that
población,
allows
a
the
los
population,
ciudadanos, tener claridad
citizens,
con cuáles beneficios
clarity on what
ellos pueden
benefits
acceder
they have
financiados por
access
los
to
recursos
that are
públicos.
financed by
El
public
plan de
resources.
beneficios en salud de un país debe
The benefits
considerar
plan
el
for a
plan de
country
beneficios
has to
específicos para
consider
la salud
the
mental.
specific benefits
Y
for
por
mental health.
último, priorizaría en transparencia y rendición
And
de cuentas.
lastly, I would
Esto nos
prioritize
obliga
transparency
a
and
mejorar
accountability.
nuestros sistemas de información financiera. Por ejemplo,
This would
estandarizando
make
los
us
códigos
standardize our
contables
financial
que
systems. For example,
permiten
standardizing
identificar de
accounting
manera
codes
clara
that
las
would allow
asignaciones y
clear
funciones
identification
en salud
of
mental.
execution in mental
Al
health.
mismo tiempo, nos lleva a la necesidad de
This leads
desarrollar
us to the need
capacidades
to
técnicas
develop
en
technical
análisis
capabilities
económicos y
in
uso de datos
economic analysis and
financieros
data
en el campo de
use
la salud
in the
mental.
field of
Es
mental
así
health.
entonces que tenemos importantes
It
desafíos
is
para
thus that we
avanzar
have
en la atención de
significant
calidad
challenges
y
in making
acceso
progress
en
in
salud
granting
mental,
quality and
también a
access
través de
in
las
mental health,
decisiones sobre
also through
financiamiento.
decisions on financing.
Muchas gracias.
Thank you very much.
Muchas gracias, doctora
Thank you very
Olga
much,
Toro, por su presentación.
Dr.
Les
Olga
pedimos a
Toro,
quienes
for your
tengan
presentation.
preguntas para la
We ask
doctora
those who have
Toro
questions
que puedan
for
usar la
Dr.
función de
Toro that you
preguntas
can
y
use
respuestas que tenemos en el
questions and
chat
answers,
para que al
the
final
questions
del
and
evento
answers window,
podamos
so that at the end of the
responder.
event we
Les
can
voy a dar la
carry
palabra
those,
a los
we can answer those.
licenciados
So we'll
Rodrigo
then let
Márquez y
Rodrigo
Gerardo
Marquez and
Bruzzone,
Gerardo Buzzone
quienes son
have the floor,
director
who
y
are
subdirector
director
general
and subdirector
del Ministerio de
of
Salud Pública
the
de
Ministry
Uruguay.
of Public Health in
Adelante.
Uruguay.
Buenos días
Go
a
on.
todos. Es un gusto
Good morning, everybody.
participar
It's
de esta
a
actividad.
pleasure to be
Solamente
part of
para
this
confirmar, porque no
activity.
ingresa el licenciado Márquez, que no sé si
So,
había podido ingresar, tenía una
Mr.
dificultad
Marquez,
pero
I don't know if he was able to get in,
igual podemos
but
iniciar.
we can get started anyway.
Bueno, eso, un gusto desde Uruguay, desde el Ministerio de Salud Pública. Yo soy subdirector general de
So
Salud.
I'm subdirector for health at the ministry. Rodrigo Marquez is the general director at the secretariat, and we wanted to tell you a little bit about how we've organized financing at the Uruguayan Health Service and tell you also a strategy we implemented last year, which is country action for mental health, which we can leave for the second point if you want, also to have something to refer to. Uruguay has the health insurance, which is a national health fund, the FONASA. This is a health insurance that was created with the reform of the Uruguayan Health Service in the year 2009, 2008, 2009, where the national integrated health system was created, which included a change in the management model, a change in financing, and a change in care. The change in financing created by law the National Healthcare Fund, which is fed by general revenue, the contributions workers do through their own contributions. They feed this fund, and it managed this reform of the system to have Uruguay have universal scope for healthcare coverage in all of its branches. Through the National Healthcare Fund, we have a system that includes a public system and a private subsystem, but it's all within the national healthcare system. In this framework, in the framework of the system, we created the National Healthcare Board, which includes the various obligatory contributions that they have. And part of the financing for general health, but also for mental health, is marked by what SONASA defines through the various obligatory revenues streams and the general plan. And these are tools that are obligatory in all sectors for all providers. As far as mental health is concerned, there are several stations, but the main ones have feature modes 1, 2, and 3 for mental health. These modes basically cause sorry for a minute, I'm just looking. They basically have to do with the economic transfer given to providers, but to start there, we have modes 1, 2, and 3, where we are basically reviewing all this because what we've identified is that some of these modalities, just to summarize it very quickly, are focused in group modalities for work, and this affects the various modes. So, for example, mode 2 affects populational groups up to 19 years of age, which includes other kinds of mental health provision. And module 3 does more specialized work. So what we're analyzing is that mode 1 has very low usefulness for mental health providers. So at the ministry, we're reviewing that because it's important to review these things and the way that mental health provision is carried out. In addition to that, some of these, some actions that can have some kind of coverage, with co-payments. You also can't have too high co-payments. So, for example, you have $2 copay for this provision in the case of the public system. For the private system, there are 3 modes of care. Now, tied to that, we are making progress in what we call strengthening of the first level. So the strengthening system of Uruguay, we already had the meeting where it crosses all mental health systems with this strategy and how they are thinking, how the mental health teams are thinking of this new way of addressing the care. So we are in charge of basically basic teams, proximity teams made up by family physicians and community health, and which can be made part of the problem as far as mental health in the population. And these proximity systems, especially some areas, they could be taking charge of other kinds of healthcare provisions that are more specialized with a little more complexity. And thus, we are thinking of how to organize the first level of care. And I say this because financing for us also goes hand in hand with the change in some regulations or some competencies that we are thinking of incorporating into some of the first level care teams that we always understood had to be there. But what we want to create this regulation and this ministerial ordinance that also organizes this care and proposes the possibility of carrying out a series of approaches by the team.
Competencias de profesionales como licenciados en enfermería a través de consultas de enfermería que pueden abordar
These are able to also work in reference to different parts in reference to being able to see the mental health. So there is where we would also need to be able to see that part of this finance that has to do with the reorganization of the competencies and of the self-team that is able to receive some of the problematics of health. It is true what the previous doctor mentioned in her excellent presentation, that a large part of the budget many times is taken to services of a second and third level of assistance. The same thing happens in Uruguay. We're also implementing the new mental health law, which has not been implemented yet completely. So in this period, we generate an intersectorial committee in a way of seeing how we are able to incorporate all of the ministries, not only the Ministry of Health, but all of the ministries in reference to this. In reference to what is being requested is to try to see the implementation of mental health and for it to be able to have progress in one of these points. One of them having to do with the development of the first level of attention. And in this first level of attention, the proximity teams are able to get part of the development of these stations of mental health with the support of the reference teams in reference to talking about this without actually having to go on to a second or a third level of assistance at that time, only to be able to mention that we're also working in the different process of organizations for the monovalent services of Uruguay. And for this, we're generating the different orders of the new dispositions in reference to establishing this, and we have a gap here in the current standards where we are generating the new norms to be able to generate this new step within reference to what has to do with the new chapter itself.
Seguido a eso, en este último presupuesto también lo que se incorporó fue que la salud mental
Here, in reference to being able to establish that mental health had been established as a priority of the national government, in reference to being able to establish that all of the ministries, not only the Ministry of Health, was able to incorporate different strategic lines in reference to mental health. And here, in reference to social development in Uruguay, the Ministry of Culture, Sports also have resources and budgets to be able to work on mental health in some of the areas that we believe are completely non-complementary, but I would say they are fundamental in reference to the approach and health of people, where it is actually unthinkable of thinking about passing just through this, but it's about seeing health in this sense in reference to culture, sports, housing, and how this participates in all of this. Here we're also seeing, and I want to be getting to the 10 minutes here in reference to the strategy of attention to the country, which was part of the participation that we would actually like to show you very quickly. But this is a strategy that was implemented last year, where what we did was have a strategy that will coordinate a budget, a public-private budget. These are funds financed by the Ministry of Health and also by all entrepreneurships, talking about all of the entrepreneurships that are in the territory working in reference to promotion, prevention, and assistance for mental health, and that in one way or another do require some kind of input or support. And here, this exceeded the expectations that we had in reference to the interest and participants that were taken. We had over 250 experiences written, and now we will finish the process of technical assessment on a court basis, and we're going to start the financing of these experiences. And many of them, we put much of an emphasis in reference to experiences that have a lot to do in reference to what take a community as something fundamental, as one of the ways of complementing the model. We are very much working everything on the sanitary existential end of how we can improve the arrival, because this is definitely going to be taken as a reference to being able to see this responsibility of being able to go towards having progress, but we also want to establish that the change in the model is effective on our end. Talking about the communitarian and cultural focus, we generate some funds, we generate more budgets as well for this, and we're actually including within the ministries as it is in reference to education, social development, sports, and housing. We also have funds in reference to being able to establish this part to see what happens with this area in reference to being able to see this specifically for this, and this definitely would be seen as something very important. And as the last part, everything, the assessment that we are definitely carrying out, we generate a monitoring group in reference to the whole strategy that is also intersectorial and that is formed by all of the ministries, and that we're actually trying to make the challenge of crossing or being able to cross in the best way possible the different indicators that each ministry has to be able to achieve indicators that are able to see that are able to not just be a number or an addition of numbers of all of the ministries, but we want to be able to have indicators that actually show you the access to people to specific services that we understand are health producers in reference to mental health. And that's why we have the challenge of seeing how we measure this, so we're not just left in a number that finally shows us the efficiency and the financing that we are developing for this area. So yes, just a very, very high end in reference to the last point. We were actually talking a lot about being able to get to education services, health in all of our schools, in a work of assistance, prevention. In reference to this, I also say this because this implies in a certain way a decision of financing when you lead human resources to be able to work in these spaces as privileged locations to be able to see one of the populations that we understand of a high priority in reference to also be working towards the first infancy in reference to being able to see this as a priority, and in that sense to be able to see the health in the classroom. That is one of the places we're also getting resources for this, and also working with teams for that location. We just wanted to mention a little bit about this in reference to what is the way that we are financing ourselves in reference to the strongest one that has to do with the National Fund, in reference to being able to see the health providers, and we're in the review process for this, but also something else that has to do with the system that has to be able to see the first level in reference to specific ends that we are generating standards so that the teams at the first level have real skills to be able to solve in the best way possible this end. Thank you very much, Gerardo Brusones Virrell. And I do not know if we have Mr. Rodrigo Marquez on the phone call yet. We will ask him. I don't think so. Okay, perfect. So, if anyone has any question in reference to the presentation of Mr. Brusones Virrell, we would like to remind you that you can ask here in the Q&A function that we have activated in the bottom part of the screen. Thank you very much. I'm going to give the word to Marcelo Quimati Diaz. Welcome.
Muito obrigado. Bom dia a todas as pessoas que estão ouvindo a gente.
Thank you very much. Thank you for having me here. I'm part of on behalf of the Department of Mental Health Against Drugs. I thank you very much. I think it's very important, this exchange of experience, and I would like to converse a lot with the presentation of Dr. Olga Toro, because I think we've identified inside of his presentation a series of issues that we face in Brazil as well regarding funding in mental health. I think the first point, so thank you for passing the slides for me. First thing is to put on some characteristics that leave the funding of the network with a series of particularities. The first one is related to a specific story. In this year, we've accomplished 25 years of the sanction of a law that modified the mental health attention in the primary health service, allocation of the resources from progressively from the hospital to a network of community attention. And this process of this allocation change, it suffered a significant change since 2007, when the biggest part of the resources for mental health, they passed to be reallocated inside of community services. The second particularity is that it happens inside the single and universal health care, that is SUS in Brazil, for a country featuring more than 200,000 inhabitants, guaranteed by our constitution since 1988. And the third particularity is that the single health system, it exists inside a model that is interfederative management model, with the management happening locally in the municipalities. So the Ministry of Health is the owner of the design, but the adequation to this model design that happens by initiative of the municipalities. The funding that the municipality does, departing from a fixed value and regarding services to be implemented, it features a cost that varies from region to region in the country. So this percentage of the Ministry of Health from the central government this resource coming from the central government to the municipalities is waived percentually. In the southern region of Brazil, for example, the salaries of the health practitioners, they tend to be higher. And regarding this, or because of this, the resources the Ministry of Health pass to the municipalities is proportionally lower. So in some regions of the country, the funding that the Ministry of Health does corresponds to almost 100% of the cost of the service. In different regions of the country, this percentual can be lower. This is a specificity. And the third specificity, within this third specificity, we have the fact that some of the countries, states, they have their own ways of funding. So this fragmentation that Dr. Olga Toro mentioned, it regards in Brazil not only to the modalities of funding, so in function of the degree of complexity and technological advance of the services, either in primary healthcare, secondary attention, tertiary attention, but the way of funding it happens in a different fashion according to the region of the country inside the system that features a design of a model that is designed centered in the federal government but operated in the municipalities.
Along all this year, it's important not to just focus on one. There has been a decline of mental health in the country, thought as a warranty of all this integrated health system based on the population. For these 25 years, in these 25 years, there has been a warranty built on universal health, integrated and comprehensive health. And this is a model that is started within the change for healthcare. And what happens in a hospital network? This is an intense process where there is a closure or closing based on the qualification of hospital beds or lids that are allocated per year. And it has increased to 120 in mental health. We have a big network nowadays. In this first slide, we can see that mental health involves actions towards people who live in these centers along with primary care services network, which we call psychosocial care network, which has as a foundation this territory service based on the population, which is characterized by the community as community services. And in the same way, it has the technology and the presence of different experts and specialists focused on different services in the system. 10 or 15% of so many services in Brazil provide different services on a permanent model of 12 to 15 days. This is a service model within a health policy system in our country with some experiences that have been adjusted or adopted recently. In the same way, this network has been complemented with different actions that have been developed with an emergency network. There is a device in Brazil that is called
open door unit with a specific complexity that is similar to healthcare, and it's not necessary, it's not a hospital, but it's the reference of general hospital. Sometimes 30 or even up to 30% have been used by users of the whole network. And the same way, when we talk about primary care, we talk about that this is a perspective that government policy should understand and focus their actions on mental suffering and different social determinants. There is some imbalance in or inequalities in this aspect, which are not focused on the population. So that's why we wanted to focus more on mental health policies, anti-discrimination policies to promote mental health with that other perspective. Violence against women and care policies toward different people are policies which are promoting health, mental health. That is why it's hard for us to have a set of public policies, something that is not representing this budget fragmentation within the Ministry of Health. This set of services, which I am mentioning today, are part of what we call, except for from primary care, we call it medium and big complexity, with a provision of expansion and its own budget. In the last 5 years, we have expanded to 60 or 70% of the budget total, not only in expansion matters or extension matters, but the number of this growth is that they have been reviewed, and along these recent years, we have had a set of new demands related to mental health through actions that have been developed with different ministries. One example, drug programs, which were split. This is a growing problem all over the world. We have had some joint actions with the Ministry of Treasury, and we started with teleconsultations. We also started with some virtual health assistance or virtual health consultations with a specific budget in the past 4 years. From the point of view of Ministry of Health, creating a department that has more capacity within a federal government point of view to create more policies with different ministries to have conditions in a healthcare model analyzing the needs of the different states and municipalities by respecting the characteristics of the different regions and their health systems. An important item to consider in this discussion, which has been very important for Brazil, is the change of concept of the different analysis and the needs of population on the mental health concept. This year, we have had a period of 25 years of mental health law. We have made a retrospective analysis, and we have seen that there is a concern
on this matter, and this has changed in all these 25 years. All what we call mental health nowadays is different from what we thought in the past. Brazil, even we have some matters that are related to mental health, teenagers, contemporary issues, smartphone usage, bad activities, apart from the growing number of psychiatric diagnoses, there is a model change in terms of psychiatric areas. We are from a country that has a lot of inequality. And that's why we have the need of acting in different situations which are punctual and evident. And at the same time, we should focus on this inequalities which are allowing this mental suffering and understood by people as mental health issues. The need of rescuing the suffering groups and how this is manifested individually brings challenges to develop public policies to deal with the source of suffering. It's very hard to understand or to focus on only just one budget, because fighting against racism is harder, or implementing better working conditions, for example, will improve the conditions of the population, and dealing with gender inequalities, all these situations which may trigger mental health, not as the first issue, but a problem that may be manifested from the individual point of view. And this slide, I am showing you the different actions and the different funding areas of mental health. By making an analysis, a general analysis, when we think about this table where we have primary health care, specialized healthcare, emergencies, and by thinking within the Ministry of Health, we cover around 3.5% in the health budget per law. And this varies according to the GDP of the country. Health in Brazil has a specific particularity to warranty the expansion of technologies in the system as a whole. There's something I'd like to highlight so I can finish my presentation, is that we have a lot of difficulties in discussing with the World Health Organization this year, and we have identified one question discussing the budget, and we had the difficulties of making this mental health analysis, not only for the mental health system, but as a social impact. There is a parameter with the need of financing the system. Along the last year, we've had more than 400,000 working licenses with 400,000 medical leaves of workers. In Brazil, there is a legislation supporting workers, which has been worked, and that is for and it's very important for workers. We are impacting the different system, not only health system, but the social system. This means a mental health cost analysis for public systems, and as we call them, or providers of medical or of healthcare, mental health. This should be like this, and all this budget, how to allocate this budget, having this discussion on responsibility, and at the same time, and from this point, we need to think about what are the different situations in this society and the different populations which are related to taxes. That's the big discussion we have in Brazil with the different regulations of betting and electronic betting games, which are related to medical leaves of the personnel of health workers. These are the points I wanted to cover. And talking about mental health policies in our country, it's quite a challenge.
So we need to talk about permanent education, continuous education, the establishment of a department within the umbrella of the Ministry of Health gave us more autonomy to decide at our discretion what to do with the budget, developing new programs, developing the strategies with light technologies for better care. But in a general fashion, it's a process that is very complex. And I'm here at your disposal to contribute with my experience in this debate.
Voy a comenzar entonces con las preguntas y respuestas a los panelistas. La primera pregunta es para la doctora Olga Toro y dice así: ¿qué indicadores financieros y clínicos podría adoptar la región para demostrar que financiar intervención psicológica breve, psicoeducación y seguimiento temprano
in APS reduces future costs for crises, absenteeism, medicalization, and hospitalization?
Muchas gracias por la pregunta.
Thank you very much for the question. In the field of investigation regarding indicators, it's quite complex. There are some indicators today that are used to be able to carry out follow-up of this mental health. One of them is how much of the budget for mental health is actually designated for primary assistance, and that is one of the frameworks that we have in reference to being able to see this. And this leads on to a certain type of intervention, and in reference to this being informed by evidence, in reference to being able to see how this is done according to the different levels of assistance. And in this case, we would actually be talking about interventions in reference to what is preventive, and we would wait for these to be developed in the community levels in reference to the primary ends. We have not had any indicators specifically developed in reference to the kind of interventions, but there have been some indicators taken in reference to being able to see what has been seen in reference to indicators in other fields of the health, which are seen in reference to being able to establish of people that are under the control in services of primary assistance. And in reference to those indicators that allow us to be able to get into certain kind of interventions, but specifically indicators linked to the type of interventions are still an open field of investigation.
Muchas gracias, Olga.
Thank you very much, Olga. The next question is for Gerardo from Uruguay, and it says the following. What indicators have defined to make the decisions in reference to how to use the financing in mental health, and how do they obtain information of these indicators? Very good. Well, I coincide with Dr. Toro in reference to the complexity that we have in reference to being able to think about indicators in this sense, which are able to exceed this. It's an area that's still an investigation in reference to us being a multi-sectorial team to actually start thinking about indicators in reference to different ministries to see if we're able to achieve that. Now, the question that we have here is right now what we currently have here as this part here are the indicators in reference to being able to establish here both private and publicly, and also in reference to the modalities 1, 2, and 3, which are the modalities in reference to what we discussed today in reference to what is seen by the system and that has a payment made to the providers so that these are actually delivered. Here we have an indicator which we called in reference to being able to see the indicators that we saw. And for example, here, which makes reference to formats in reference to group intervention for some kind of population, which does not actually give us a lot of use. We don't have much development in the response of why in that indicator, going beyond the hypothesis that all of us can have, and that excludes certain dimensions, but that are able to see this culturally speaking in reference to the demand of the population has in reference to the health services. I think that here there is also a way in how the population understands that they solved their mental health issue, and also some aspects in reference to the sanitary end, which at least for us, this is one that makes us start thinking in reference to being able to see how we are able to work on financing and the rendering of services in reference to what we are able to incorporate this in a mandatory manner. This is an important indicator. And also another important indicator is the demand and weight. Talking about sanitary ends, not really in reference to other areas that I would understand are super important. And for us, the report in reference to this, to different specialties, in reference to these indicators, when talking about the financing, not only in rendering of services, but also in human rights and in reference to being able to specialties, in reference to being able to see that there are more difficulties in reference to these places. So this is another variables in reference to being able to see this financing that is done in reference to being able to see this rendering of mental health, and also here in reference to being able to establish where we would need to get to first in the largest stations, and then also in reference to other things that we can take, but these are the most largest indicators. Thank you very much, Gerardo. Now a question for Marcelo Quimati. To what time
vem sendo implementada e quais têm sido os principais desafios identificados durante
how
sua
long the
implementação?
Network has been implemented and which have been the challenges during its implementation? So the first services regarding mental health care within this model of community services with multidisciplinary teams, those are services that work with this logic of open doors, so-called open doors, to which people has access without being forwarded by another physician, by another service. So they started to be developed without a central government funding. By the end of the 1980s, starting of 1990s. And with the law, the milestone of the psychiatric reform from 2002, we've started to have public funding from the central government with the development and the design of an institutional model with a certain number of professionals, how they should work, the number of users per practitioner, so dimension, the population versus number of practitioners, number of inhabitants, and types and number of services to be implemented. So it started with an ordinance from the Ministry of Health from 2002. So it's been 24 years of funding, federal funding, to this model of service. We've had a threshold of expansion in the beginning of the 2000, and but it started to ramp down between 2020 and 2022. We've had the decrease of the number of enabled and authorized services, and we're trying to ramp up. We started to ramp up in 2023 for many reasons. The first one, regarding the number of practitioners that we have available. So Brazil features a great number of institutions that train practitioners, but the speed of the services opening, it has not been accompanied by the training of new professionals. For example, psychiatrists, physicians who trained in psychiatry, specialized in teenagers and children. We've had it's a phenomena in terms of number of children and adolescents with many disorders and need to care. And we don't have the proper number of trained psychiatrists specialized in teenagers and children for this network. Occupational therapists, for example, the greatest part, they are attracted to the private network because of market questions. For example, for the private network treating children, helping children with autistic disorders. That's the first one. The second one, it's the need of a change of mindset. So the psychiatry hospital, the mental facility plays a role in the imagination of people, that they work only to scare and because to scare people, to treat people with mental health because they're dangerous. But we are trying to change this mindset. And the idea is to treat people, for those mental ill individuals, for them to be reinserted and to have decent lives in the society. And the third, it's the need of creating new strategic problems for better income generation through solidarity economy, because the market has a difficulty to absorb people that had experienced mental health commitment. And we start to create programs to disinstitutionalize, decommit. It's kind of a decommission, between commas, of people that have been committed. And they need, so the society and also the individuals, they need to change their mindsets. So that's why I would like to make, a very important highlight in two indicators. There's one indicator that is used internationally, that is used in collective health in a general fashion, that is very important. So I find it very important, the applicability of it in the mental health network. So the concept of avoidable commitments, but a parameter of good service is not to commit people with problems like not only mental health, but internalization and commitment. For example, a hospital that do not admit someone with pneumonia, so it's a good indicator. So they can avoid the internation, avoid the hospitalization of an individual and treat this individual in logic of a community care, primary attention. It's a good indicator. It's an indicator of a good service. And there are many indicators. Among them is the number of people among 100,000 inhabitants that are followed up or treated according to epidemiological references. If 1% of the population suffers from schizophrenia, this 1% of the population must be inserted in some healthcare network. Those are severe problems, and if we don't have a continuous care, continuous follow-up, that person necessarily would impact some financial impact on the system through commitment slash hospitalization. Thank you very much, Marcelo.
The next question is for all of the panelists.
¿Piensan que sería fundamental capacitar a los equipos de APS y comunitarios que podrían tener insuficientes competencias en salud mental para que sean resolutivos? Entonces, calcular el presupuesto no solo para prestaciones, sino también para capacitación de personal no especializado. Los invito a que abra el micrófono quien quiera tomar la palabra de los panelistas.
Quizá yo pueda partir. Cuando estamos hablando de que hay un sistema de financiamiento, entonces podemos acoger este tipo de desafíos que tiene el sistema de atención, porque
We can talk about this challenge that we have, because what we should be aiming for is to be able to have a system that collaborates, that contributes to the development of this attention system. And that is why the decision-making of countries goes beyond this than just the appointing of budgets, but it's about the coherence of the finances system with the policy that is trying to be implemented. And in this sense, of course, the financing system should consider the sense for training, and it should also establish that there are resources to be able to ensure that that training is done in an effective manner. But it should also generate lights and signs to the education formal system in a sense that it is able to incentivize these skills and competencies that need to be incorporated within the formation programs of professionals and technicians that are to be able to work through the health system. And here in reference to being able to see and align these incentives. It's not that the financial system is going to solve all of the challenges of the development of the system and development of mental health, because there are other decisions that are of the technical field, scientific field, political, and of management. But what is established in this case is that the financial system is aiming correctly to this contribution, and not as it exists today, the concern in many countries in which the financing system is playing in a contrary end. What this is about is that in this point, to be able to align the system of financing to the policies in the sense that is correctly established in that same direction. Thank you.
Muchas gracias.
Thank you very much, Dr. Olga Toro, Gerardo Brusone Birriel, and Dr. Marcelo Chimati for your participation today. I don't know if anyone wants to add any comments in reference to this last question.
Gerardo, ¿quieres saber cosa? Yo tengo una cosita pequeña para decir sobre esto.
Yo solamente totalmente de acuerdo con lo que dijo la doctora
I
Toro.
completely agree with what Dr. Toro mentioned. Specifically speaking, here we are working in a very important alliance with the Universidad de la República. We have a sector of education, formal education that works with us, and we are developing currently trainings for teams of first level and the strategy of reinforcing on the first level. I think it is a fundamental in reference to what we are able to find for us to be able to generate the different competencies that we have in order for this to be set. And this is in reference to the financing, not only the money, but it's also about seeing that these teams have the competencies and skills to be able to arrive at solutions. Some of them in reference to some things, in reference to being able to establish what is and trying to set other paths that are also going to allow us to solve other matters with the health team. And this is definitely going to have a positive impact in the health of people, given it that is more effective. But we also do consider that this is the way how things should be done in a positive impact in people, considering that it's also going to be more efficient. Training in reference to being able to see this from these competencies and skills at the end. Thank you.
Muy rápido. Lo que dijo Olga está perfecto.
Very good. What was said by Golden is perfect. I do believe that something that is very direct in reference to this kind of training, this should be done so that there is some kind of capacity of diagnosis, because here we are looking for the reasons as a social phenomenon in reference to the primary assistance being ready to change something in the community. It is very important, and not that it is training based on the capacity or the increase of the capacities in reference to what is done.
Muchas gracias.
Thank you very much. Thank you, everybody, for all of your contributions today. Those of you who've been sending questions, anybody who has been saying hi from different countries in the region, thank you very much for participating today. And I would then hand the floor to Carmen Martinez Viciana for the final comments.
Bueno, muchísimas gracias, Luz. Gracias a
Well, thank you very much, Luz. Thank you, everybody. I think these have been really comments, presentations that add a lot, add so much. So we're getting near the end, but I think some elements, important elements came up, and I didn't want to not mention them since we have a few minutes near the end. So those elements that are key, some of them have been very relevant that we won't be able to summarize, but I would like to leave as end of the party, sort of, so to speak, some of these contributions today, some of these comments. Let's remember that financing models for mental health are specific budgets, deconcentration has been made part of the financing, incorporating these financial incentives and services, always with a community base for mental health, ensuring the necessary balance between assigning efficiency and technical efficiency while prioritizing one way or another, the
priorizando aquellos
prioritizing
aspectos
those aspects
que son fundamentales
that are fundamental
para
for
poder llevar a cabo esa
to be
calidad
able to
real
carry out that
de las
real
intervenciones.
quality of the interventions.
Quisiera también
I would
de
also
alguna
like
manera
to,
destacar
in a way,
cómo nos
highlight
contaba
how,
además de algunos de estos elementos que
in
comentaba
addition to some of
de
these
la,
elements
de la
being mentioned
doctora Olga Toro,
by Dr. Olga Toro, how she was also
desde de Rodrigo, ¿verdad?
how
Y nos
Rodrigo
comentaba Gerardo, perdón,
and Gerardo were
Guizzoni, pero también nos
mentioning with
comentaba
Gerardo Guizzoni, but also
el doctor Marcelo
Dr.
también
Marcelo Chimati
cómo
was
han
also
ido
telling us about
avanzando
how they've been making progress
hacia lograr que se puedan
towards
estar
managing
no
to
solo
be
financiando
not just financing
a nivel más,
at the
más
more
federal o a nivel más
federal
nacional, sino
or national
también ir
level, but
hacia esos recursos
also going
específicos
toward those specific
por parte
resources
de los
on
propios
the part
profesionales
of
de la salud mental
the
que están, por ejemplo,
healthcare professionals
descentralizados,
themselves
¿no?
who are
Nos
decentralized.
comentaba Gerardo Bruzzone, ¿verdad?
Gerardo
Desde Uruguay,
Bruzzone
ese fondo de
was telling us
salud
from
en el
Uruguay
que tienen
on
ese
that
sistema con las
healthcare fund
prestaciones
where they have a
obligatorias
system with obligatory
o esos formularios terapéuticos de medicamentos
contributions
que
or those
incluyen esa
therapeutic
transferencia también
lists
financiera
that include
a
that
servicios
financial transfer
obligatorios,
to
incluyen tanto a nivel
obligatory
individual
services,
como
both
a nivel
individual as well
laboral,
as
pero también hacia
group,
poblaciones
but also
específicas
toward
más
specific
vulnerables
populations,
y
the vulnerable
y aquel
populations,
esfuerzo que están
and
haciendo
that effort
para
that they're making
fortalecer el
to
primer nivel de
strengthen
atención
the first level of care.
y asumen
And
esos
they
equipos,
are
¿verdad? De
taking on,
proximidad, como nos
these
comentaba, que
proximity
refuerzan también el
teams
financiamiento
that
que
also
incluye
reinforce
aspectos
the
tan importantes
financing
como la
which includes
desinstitucionalización de la
such
salud
important
mental
aspects such as the
en la reforma
institutionalization
del
of
sistema,
mental
¿no? También el
health
doctor
in the system.
Marcelo
Dr.
Chimati nos
Marcelo
comentaba
Chimati was also telling us
cómo en ese nuevo
about
modelo
how in this new
psicosocial que está
model,
también
this new
centrado en la atención
psychosocial
primaria,
model also
pero
centered on
en el que
primary
también están los
care,
sistemas de
where
emergencias, de
you also have
urgencias,
emergency
la
systems,
atención
urgent
psicosocial
care
estratégica, el
systems,
sistema
strategic
residencial
psychosocial
también
system, the resiliency
y
system,
todos esos servicios
and
hospitalarios, pero que
all of
todos
those
cuentan
hospital
con un
services, but
financiamiento
have them
de
all
responsabilidades del
count
Departamento
on
de
specific
Salud Mental,
responsibilities
pero
on the part of
que combinan
mental
una
health.
gestión
But
descentralizada también
those who
inyectando
combine that
recursos de
decentralized
manera
financing
muy
also
clara
inject
hacia profesionales
clear
que estén
resources toward professionals
desconcentrados, ¿no?
who are deconcentrated,
Me
decentralized.
llamaba
So
mucho la
it
atención esa
seemed
necesidad de
noteworthy for me
adaptarse al
that
grado de
there's this need
complejidad
to adapt to the
tecnológico
degree
del
of
sistema,
technological
que están
complexity
adaptándose a
that the
los
system
municipios en cuanto a
has,
sus
that is
necesidades
being adapted
específicas y
to the
por lo tanto que no sea
municipalities,
un
their
modelo
specific
único,
needs,
¿no?
so
de
that it's
presupuesto
not
y de
a single
financiación.
budget and
Y bueno,
financing
para
model.
finalizar, quiero
And
resaltar
to
que
end, I would
claramente
like to
estamos en un
highlight that
momentum
we are
muy
clearly in a
importante
very
en
important
el que se
moment
destaca el
where
necesario
we are
cambio
highlighting
del
the necessary
paradigma de los
change
modelos
of
de
the paradigm
financiamiento.
for financing
Estamos
models.
aprendiendo
We
de
are
estas
learning
experiencias de
from these
países como
experiences with
Brasil
countries
y
like
Uruguay,
Brazil and Uruguay,
pero también de los
but
desarrollos
also
académicos
from
y de los
academic
aportes de la
developments
evidencia para
and
avanzar ante
from
estos
evidence
desafíos que nos
in
plantean
order
las
to
políticas públicas,
address
en
these
los que
challenges that
requerimos
public
mayor inversión,
policies
pero también calidad del
place for us,
financiamiento, ¿no? Con
where
esa
we want investment, but
redistribución
also
que
financing
veíamos de los
quality with
recursos
that
hacia
redistribution that we
servicios
saw
tanto
of
comunitarios como
services,
de
both toward
atención primaria.
community as well as
Bueno,
primary
y ahora ya
care.
sí queremos
Anyway,
de
so
nuevo
with that,
agradecer
yeah,
a
we'd like
nuestros
to thank again
maravillosos
our
panelistas,
wonderful
a Olga,
panelists,
Gerardo y a Marcelo,
Olga, Gerardo, and
a
Marcela,
todos y todas los
Marcelo,
participantes. Hemos
and
tenido
all
lleno
participants.
en la
We've
sala,
had
algunos han tenido que quedar
full
por fuera sin
room.
poder
Some had to
participar
be
con
left out
nosotros. Quiero también
without
agradecer
being
a
able to
Luz, nuestra
participate. I
moderadora,
want to
a
thank
los
Luz, our
intérpretes, a los equipos
moderator, the
técnicos y
interpreters, the
administrativos que han
technical
hecho
teams, and
posible
administrative teams
este webinario
that made
y
this
este
webinar
diálogo que
possible,
esperamos
and
que
this
siga siendo
dialogue, which we hope continues
un
being
diálogo con mayor
dialogue
intercambio
with greater
a
exchange
nivel regional.
at the
Esperemos que
regional
contribuya
level. So let's
realmente
hope
a
that it
fortalecer las
contributes to
discusiones y las
strengthening
acciones orientadas
discussions and
hacia
actions
avanzar a
oriented
modelos de
toward
financiamiento más
making
sostenibles,
progress toward
equitativos y
more
pensados en
sustainable,
la comunidad
equitable
para la salud
uh,
mental de las Américas.
healthcare
Muchas gracias
system
por
centered on the
acompañarnos hoy
communities in Latin
y les
America. Thank
invitamos
you
a
very much for
mantenernos en
being with us today,
contacto con
and we
las
invite you
iniciativas de la
to
Organización
stay in touch
Panamericana de
with
la Salud
initiatives by the Pan American Health
en salud
Organization,
mental y
uh,
específicamente en el
specifically when
fortalecimiento
it
en
comes
general
to
de los
mental health
sistemas de
and in
salud. Muy
general
buenos días a
strengthening
todos
of
y todas.
healthcare
Muchísimas
systems.
gracias.
Great day to all of you, and thank you very much.